we can start, Antra.
Yeah, you already started, and I just want to again and again say thank you for so quickly agreeing to give us this webinar, because from the March, all what we heard was no, don't do this, don't do this. But what should we do? I think definitely we have many things what we can do to stay fit. And so I'm really very thankful to you. And so I give floor now to Dr. İlter Denizoglu from Turkey, and I hope we will get many knowledge to use.
Can you see the slides perfectly?
Yes.
Okay. The right and left parts are no cuts. Yes?
Everything.
Okay. So now we can start. You know, Richard Strauss quote, he said, human voice is the most beautiful instrument of all, but the most difficult to play. Form follows function. This is what we say. It is a very important principle in voice therapy and singing voice therapy. What it means, if you can change the function, then you can change the form. So in singing voice therapy, we concern with habilitation and rehabilitation. Habilitation is the process of enabling, equipping for, or capacitating. Capacitating a skill or a movement that the artist needs on stage. The rehabilitation process is another thing. It is a treatment process of a professional vocal performer with a given voice disorder related with vocal use with behavioral methods rather than surgical or medical methods. So we change the faulty behavior. Our rule of thumb is not every singer is the same. So we always keep in mind not to create the same instrument out of everybody. What do we change during therapy, voice therapy or singing voice therapy? First of all, we change the anatomy. Why? Because with the exercise, the mucosa have some microarchitectural changes. The muscles develop, they change. You know, when you go to bodybuilding, your body changes. You can see it in the mirror. And we change the muscle contraction pattern. If you exercise with marathon running, then the pattern that you are walking and running will change. And we change the behavior. It's not enough to hit the sixth C of the piano in the rehearsal. You have to hit that note during you are singing, and it should be healthy. It should be easy for you. It should not be a catastrophe. So you are a sportsman. If you exercise and perform regularly, your level of performance maintains the anatomy, the muscle contraction pattern, and the behavior. But if you don't, anatomy will change as your performance skills do. The vocal performer is an Olympic vocal athlete for us. And the voice is the main instrument to be cared for. Singing as a craft has two dimensions. The first dimension is the artistic performance, which keeps time, intonation, sound, and expression inside. And it should be efficient. The artistic performance is efficient and sufficient for the people who listen to you and for you as the performer. But singing as a craft has another important dimension, the sportive performance. You know, the football player should run for 90 minutes, and he should have enough power to hit the ball at the 90th minute to make the goal. So the sportive performance is very important for an active performer. Efficiency and sufficiency about durability, speed and agility, timing and focusing, sustainability, and last but not least, motor learning and practice. Vocal fitness in this sense can be explained in two ways. First of all, the skill should be fit with your talent, education, and power to perform this talent and education results. And the stamina, the sustainability of your voice on stage for your performance, and stability. You have to sustain your vocal performance for some hours on stage, and you have to repeat it every 2 days or every day in the week. So you have to be stable. We are using our muscles for vocal fitness, mainly, of course, because muscles are the source of the movement in our body. There are two rules in the world of muscles. The first rule is muscles cannot think. They cannot decide by themselves, but they have a powerful memory. The second thing is, if you don't use your muscle, you will lose it. These two things are very important in our life. So, what happens? What happened and what will happen as a consequence of the non-performing COVID-19 period? First of all, the singer's sportive performance factors might be affected, and possibly many singers suffer from this problem. What happens? The muscle power decreases, and the condition, sustaining the power until the end of the performance and repeat the same performance quality every day. These two things are affected. And there's one important thing, the stage confidence. Because is it possible that training and game are the same? No, it's not, never. Because training is perfect. Okay, you have to do the training. But if you don't perform at the real game, it's not the same. I mean, this thing can only happen during the real game. So you never know. How we prepare our patients for the real game, for keeping their vocal instrument fit and ready to perform. That's a schedule that I have prepared years ago for the students for my students in the Conservatory of Music. We have from simple to complex. We have a schedule, and I call it the multi-axial approach of singing voice therapy. There are 6 axes for thinking what to do for a singer who referred to the clinic. The first axis, and the whole system is one in the other. So this is how we approach. First of all, for each and every axis, there is something to do. So at the first axis, we'll look whether there is a medical problem or a surgical problem, if there's a polyp, cyst, varice, or inflammatory condition, whatever. We cope with this by giving medications or by surgery, etc. This is the axis 1. The axis 2 is the common practice. We apply the axis 2 for each and every singer who referred to us. So it is, first of all, cognitive support with counseling, explaining, teaching, instructing, and we give some vocal hygiene proposals for performing voice, and we work with core elements of vocal pedagogy. I'm going to speak about them as an example of the practice just after this theoretical one. The axis 3 is an advanced practice for habilitation. So we refine the primal sound, and we make some vocal muscle development exercises, but all of them should be in purpose. They are not without any purpose. So we work with some support strategies, and if possible, we follow our patients on site on the stage. The axis 4 is the psycho-emotional support. It's very important. I mean, stage performance is full of psycho-emotional conditions, and musical performance anxiety should be coped with pre-performance, performance, and post-performance strategies. Axis 5 is the craft coaching. It is a teamwork, and this craft coaching is very important for the final success for the performer, the artist. And the axis 6 is an interesting thing. The Millennium Falcon from Star Wars. It's an old starcraft, ship, and it is always broken. But at the end, it gives success after every mission. So if a patient has a small polyp, but it doesn't make any problem in the performing success, so we don't touch it, but we just keep our follow-ups for these patients. So it's a global assessment of functioning. If there are some small things that does not change the global success or performance quality, then we just keep on following. So doctorVOX voice therapy is a singing voice, direct voice therapy technique, can be used as a singing voice therapy technique. It's a holistic approach for general use, and it gives a multi-channel biofeedback. It can be done with different devices, simple devices, or some others, as you are going to see. And it's based on Marketta Sihvo's LaxVox exercise, and we are sending a great hug to Marketta from Finland. The pedagogical framework in DVT is very important. Why do we need a framework? Because we need to understand what we are doing, for what, and we need to know what's next. What are we going to do next step? Or what are we going to give to our patient for the next step? So, as you can see, there are 3 dimensions here, and there are 4 levels here. What it means, as the pedagogue or the clinician maybe, there's an action plan. I'm going to have a preset step level, then explore the primal sound, and then I'm going to develop the muscles of the larynx and the sound that we hear from our body, the whole instrument, with some vocal exercises here. And at last, the new skill should be adapted to a behavioral transfer, because the patient on the stage, the singer on the stage, should not think about how to hit the soprano, sixth C, or whatever. And you shouldn't think the note. You should think how to sing, how to give your thoughts and emotions to to the people who are listening to you. But at the same time, we have to be aware of our students or of our patient, because if you try to give an exercise, skipping these levels, just giving an exercise, because your student did not understand why or what he is doing, he is not at the associative level of the motor learning phase, this exercise will be only a memorized vocal pattern, and it will not work. Because of that, we start with cognitive study with the other preset studies of the DVT program. So there's another way to explain this framework. And what we do is, do you see me also, Antra? My face is here.
No, I think we only see you on the side of the screen.
Oh, okay. Okay, it's no problem, because if you see me on the side of the screen, it's okay. I'm going to show you something else. In practice, the DVT coming from the LaxVOX tube, it combines two things. First, we have a resonance tube. It's a simple tube you can find from everywhere. We call it the LaxVOX tube. It's a silicone. So I elongate my address. Now you can see me, right? The whole, because I don't see myself, my face here.
Yes, we see.
Yes,
See.
okay. Okay. Maybe I can see myself also. Whatever, no problem. So I elongate my vocal tract with a tube. Okay, this is the resonance tube phonation. And semi-occluded vocal tract, I decreased the diameter of my mouth, and when I put it into some water, I added a resistance to my sound. So this is the idea. And after what we have done, we also, this is the tube, you know, this is the doctorVOX device, but it's the similar thing without the tube. You know, it's a tube, and you have your water, and but we add also the free articulation. So you articulate into the mask while you are having the advantages of the physical process of the elongation of the vocal tract and back pressure. This is the idea. We also provide something else, because I'm going to speak about this afterwards, because for the COVID rehabilitation, you need to have a humidified air. So if you take the air from the other part of the device, the dry air comes from outside, humidifies in the water, and you take it out. And also, the rehearsals are important, because especially for the opera singers, the rock singers, which demand on high loudness levels, you need to make the exact rehearsals, but without disturbing other people around you or the neighbors. So with the mask, you can also make a quiet rehearsal. What is quiet rehearsal? The mucosal impact between your vocal folds is not so much as in the real stage performance, but you keep your muscle training almost same on what you do on stage. I'm going to give an example. So you when you make your rehearsals inside the mask, it's not heard as you create the voice. So it's very important for us also. Breath management, you can see, feedback is very important. Also, we have a DC valve here. When you make your expiration level a bit higher, or for the inspiration, so we use it during rehabilitation, pulmonary rehabilitation of the COPD patients or post-COVID period. I have spoke about the physical effects, and we have some physiological mechanisms. I'm not going to speak about them separately, but please be aware that each and every exercise we give to our patient has a meaning. It has an aim, each and every exercise. What happens during this is the vocal folds, and you can see bubbling. Look, now so it's what we call the massage effect. Look, this is without bubbling. So you use your muscles with the full power, but the mucosal impact is not the same with the non-bubbling time. And what happens after DVT program? Remember, if you can change the function, you can change the form. This is a patient from our gallery. So you can see the back part of the glottis, the posterior glottis, does not close. Ideally, it closes like this, but now it closes like this. With the this is very important because it came with 3 months non-performance. So after therapy, this is the resonance voice. You can see the perfect vibration of the vocal cord. And she's very happy.
Sorry, we don't hear you while the video we don't hear.
Okay. Wait. So the patient that I showed you that you didn't hear me, I'm going to speak about that patient. I cannot pause it, but so but you can see me, right? Yes. So the vocal folds are supposed to work like this, vibrate like this. The patient whom I showed you cannot close the back part of the vocal folds. The posterior glottis is open, so there is a huge glottal impact at the front part. So in order to keep the impact in a balanced way, we need to work with the muscles which make this or this. So we work with this patient in a way that I'm going to show you in a few minutes, and you saw how it worked perfectly. No, wait. Now you can see another tongue. You see the front part of the vocal folds do not work, and there's some mucus. Mucus has gone, and front part is. So with this patient, there's the front part gap, the anterior glottal gap. So the other one was like this one like this. This is another part, this is another insufficiency, you remember from the insufficiency. So think about you're a football player and your steps are not like this, but you are stepping like that. So lateral parts of your feet are not touching on the ground, and the whole body weight is on the medial part of your feet. So that's the problem. It's not sufficient and efficient. So what we did is to close the front part of the vocal folds. The last one is a vocal nodule, because the vocal fold closure is like that. This one comes with the hourglass shaped. Let's see.
Bir daha. Bir daha. Bir daha. Nefes. Bir daha.
For this patient, we can see that her vocal vibration style has changed. So small bumps are less visible, and they disappear in some weeks or months, if not months. What did we do in these patients? And what you can do yourselves in this non-performing COVID period. First of all, remember the pedagogical framework in DVT. Counseling is very important. What is counseling? Please keep in mind that you are not performing, and you are not making the sportive skills active in this period. And maybe the vocal hygiene is gone away. So you have to maintain your sportive skills and condition with vocal exercises. So this is the counseling way of counseling. Okay, please be aware that you are not singing actively, and it will take many things off from you. Vocal hygiene. What is vocal hygiene? When you are singing, the stage performance makes you to take care of your voice. It's a great motivation. When you are not singing, you can drink some more wine. You can yell at somebody else because you're not going to perform at this night. So please, Be aware of mechanical trauma and voice abuse. Be aware of humidification and hydration. Drink at least 2 to 3 liters. Oh, come on, I'm not singing. No, you are going to sing. And you don't make the sins of laryngopharyngeal reflux, drinking, eating, whatever. And don't smoke. I'm so confused. I'm so unhappy. Let's try something else. Don't try it. It's very bad for you. This should not happen. Your instrument before the COVID period and your instrument after the COVID period. I mean, this is what we are speaking about, vocal hygiene. Non-performing may also cause muscular problems in your body, especially in your body condition, weakening your support muscles, weakening your vocal muscles, and displacement. Because when your vocal vibration pattern, your phonation skills decrease, then you try to compensate it. This is what the singers try to do that I showed you. Compensation mechanisms via maladaptive behaviors may damage the technical skills. Stay fit. Exercise daily, body exercise for at least an hour a day. You can divide it into 2. Eat the right foods and portion each meal. And keep track of your calories and food intake per day. Be sure to get sleep and stay motivated. How you can motivate? You can perform online with the same safe distance. You can go some, theaters with the safe distance and, mask hygiene rules. There are still some, as in Salzburg, it has happened this year. The second way to think about the preset stage is posture and breath support. Remember, your body is your instrument, and it has some physical lever mechanisms. There's an upper platform which carries your head, and there's a lower platform which carries the rest. Noble posture, as you all know, is very important. There are many issues about the posture, but keep it simple. What is a noble posture? Sternum is high because it supports the extrinsic laryngeal muscles when you do this. Your shoulders are relaxed, very nice, and the active spine. Tail is up like a cat walking on the street, so that you can make your head balanced and you can make your abdominal muscles not like this. No, don't try hard. So this is one of my best favorite slides, the formula of breathing for singing. So it is the posture, the proper posture at the first level to keep a proper breathing for singing. And then, the low breath, and just remind yourself about your technique in posture, breathing, and so on. The primal sound. This is very important. From the nucleus satellite model of Janice Chapman, well-known academician in London, I love this. She says that there are 3 core components of your singing instrument: primal sound, postural alignment, breathing, and support. So the primal sound is very important. The others are all satellite components. The primal sound is your natural self voice. It's the normal voice. And you can just lose it in many ways. In stress, in infection, in decreased condition of your body muscles, and in so many ways. Every day, remind the primal sound the performer in you. But what is the primal sound? How to find the primal sound? It's so easy because everybody can cough. I mean, coughing is a very reactive, reflexive, efficient way of our vocal folds. In which language did I cough? Turkish? I don't think so. I mean, are you English because you coughed in English? No, it's not. Coughing is a human language. So just keep the coughing sound. This is my primal sound. I'm not doing anything here. While you are yawning and sighing. This is the primal sound, and you can find the primal sound just like this. And go with the primal sound. It's a neutral vowel, schwa. The vocal tract is neutral, laryngeal configuration neutral, and syllaphase, you know, this exercise, this maneuver fits there well with the primal sound. So what are we going to do with the primal sound? We can refine it first. For the glottal attack and damping, when the bubbling comes first, it is breathy attack. When the sound comes and then the bubbling, it is hard glottal attack. They should come together. Or and then we, after refine the primal sound, we can go with the basic exercises. The basic exercises, pitch-based basic exercises, the sostenuto exercise. Sustain the primal sound tone and keep the same tone from the beginning to the end. Glissando. Oh! So we keep the same bubbling pattern from the beginning until the end of the glissando. I mean, it's not, it doesn't, it shouldn't be like this. No. This is how TA muscle and CT muscle work together in balance. Like this. You see, the bubbling is the black. Where are you? Yeah. This is the bubbling, how it goes, and this is the sound. The bubbling is constant. The sound goes up and down. The bubbling doesn't change. And the portamento exercise in the DVT. Oh, so we are making the things a bit more and more complex. And then in the, you know, this is the portamento, bubbling in voice, and portato exercise. So we unconnected tonal steps. But here, the bubbling goes on. The bubbling continues. In here, in staccato, the bubbling and the sound disappears in the pauses. So this is how we do the staccato. In loudness-based basic exercises, we use some stable and variable exercises. You can say, this is what we call the messa di voce exercise of DVT approach. Then we can combine these whole exercise program with different ways. You can do any combined exercises. For example, this is one of my favorite to close the back part of the glottis. 5 staccato and 1 glissando. Which combines 3 different muscles. Or tracking the tone exercise. And so on. The corridor exercise, I have to show this to you. This is my favorite in DVT. When you try to increase the vertical larynx position, then you feel a corridor which is narrowing up. But if you use your CT muscle in order to increase the stretching of the vocal folds, then you feel this forward and downward. And if you can open the false vocal folds, and then you can make similar things at the backside. Linguistic load. Up to now, we spoke about vocal exercises made with schwa, the neutral vowel. But now it's not easy to say ah into the tube. So then we use the mask, as I told you in the beginning, for the linguistic load. This is one of my drawings on the board. So you can also add some linguistic meanings to your corridor exercise. So we are now mixing the source filter theory of phonation and the basics of registration together. So I can do this. Something like that. And then you can change the vowels with different notes with the linguistic, and then the behavioral transfer. So what we do in the behavioral transfer is, first we start with basic exercises, and then we pass to the linguistic load exercises, and then we sing some song into it. Happy birthday to you. Happy birthday to you. Happy birthday. So when you make when you are in the borders of the safe SOVT maneuvers, it's okay. You put your phonation into a way, and then you take the things away and you sing with, I call it the orthopedic shoe effect. When you wear some orthopedic shoes, if you are walking like this, you have to walk like that. So when you take the orthopedic shoes out, you walk for some time like this. And if it is adaptation happens at the fourth level of DVT happened, then you go on walking like this. If you walk for 100 meters, but your motor learning is not finished, then your gait will be like this in 100. So you have to exercise to keep your motor learning process finished and mature. And the musical performance anxiety. It is very important for the people who are on stage to perform on stage actively. And this is the most important thing for me to cope with musical performance anxiety. If you are performing twice a year, your anxiety will be a like a mountain. If you are performing twice a week, then the musical performance anxiety, it's okay. It's always there. The child inside you is always there, but it will be better. For the environmental factors, we have many things, especially if you are still performing at theaters. Please be aware that the virus can come to you via air, via anything that you touch. Because of that, you should organize everything so well. And if you are not performing the daily use of different exercises, very important. But as we have a schedule, you know what to do. I mean, every day, twice a day, 15 minutes, just start with the primal sound and keep your, at the preset, keep your body in a prince or princess, and then say the primal sound, and then put it into the and then sostenuto, glissando, portato, portamento, and sing into and sing outside. This is one session that you can do in your daily life. The warm-ups are so important. The register study is so important. Cool down, so important. So this is the recite for daily workout in DVT. Be a prince or princess. Bubble with the warm breath. Keep in your mind that the bubbling is equal to your transglottic air rate. And then phonate the primal sound through bubbling. The mask, sing into the mask and sing out. 2, maybe 3 times, 15, 20 minutes each. About the pulmonary rehabilitation, for 5 minutes, I'm going to speak about pulmonary rehabilitation. For pulmonary rehabilitation, we need some parameters. Resistance. Resistance is important because you need to force, but forcing should not be misunderstood. It should be under control to a level that you can make, which should be also proposed by your pneumologist. Expiratory muscle strength training, inspiratory training, then humidification is important, hygiene is important, especially at the glass apparatus. Hygiene is good because you can wash it with the detergent from your kitchen and it's okay. Additional oxygen for personal use, of course. Additional oxygen is important. I'm going to show you something for the additional oxygen. We are now working on a new gadget here. This is what we do. So there's a mouthpiece here. If you need some oxygen during your pulmonary rehabilitation process, you can fix it to the oxygen source and then so oxygen comes to the mouthpiece directly, and you force this oxygen to go to the deeper part of your lungs. So for the expiratory exercise, for the patients, the feedback is also very important because they don't want to do everything because they are after the sickness period, they're tired of doing everything. But bubbling itself is a feedback. So it makes you understand that you are doing the exercise properly. So you can both use inspiratory and expiratory exercises with the same apparatus. Water humidifies the air. Additional oxygen I have shown to you. So 1 hour and very fast ways of some proposals for your non-performing period. Art is a window opening from dreams to reality. We need art. Art is not only a joy, it is a craft business, and it is very important. It's like food or water for us. And artists are in the need of scientific applications because they need to keep on performing. Stage performances.
Fly me to the moon, let me play among the stars.
Let me see what spring is like on Jupiter and Mars. In other words, hold my hand. In other words.
So thank you. Do something like that because it's something also like the stage. May the force be with you, and don't worry about anything. It will pass, and we are going to speak about these bad days hopefully next year.
Thank you very much.
Thank you very
Thank you
much
for listening and
Teşekkür ederiz İlker Hocam.
rica ederim. Hoş geldiniz Ayhan Hocam. Nasılsınız? From Turkey. So if you have any questions, I would like to answer them if I can.
Yep. May I ask a question?
Please.
All right. So my question is about breathing in the humidified air. So if you take the doctorVOX device, you have one end for singing and the other one for breathing in. So how do you practice the breathing in? Like you breathe in through your mouth?
No.
Yeah.
Mouth. I mean,
yeah.
Not from the nose, from the mouth.
Yeah.
I mean, and then?
Okay.
You can put some volatiles, some drops into the water. And if you are in the rehabilitation period of your disease, then with the help of some resistance, you can rehabilitate with the, for example, steroids, whatever, but it should be under control of a medical doctor.
And so you alternate as well. So you breathe in and then you take the other end and you bubble and then you change this around. That's how you practice it. All right. Thank you very much.
Welcome. There was somebody else? Please just unmute and ask anything. Or if you have any comments, please.
Thank you, Ilter. And just to say that Ilter is going to speak at a delayed EuroVox event. We have planned a symposium on April the 11th with the British Association of Teachers of Singing, and you'll get information about that soon, but Ilter is going to be able to present some more and share in a discussion about his work and the work of other people doing SOVT exercises. So look out for that. And it's great to be here, and thank you so much, Ilter. It was so clearly explained and I loved all your pictures.
Thank you. I see many faces here. Lieve, Isabella. Valda. Okay.
Thank you very much, Doctor. You have very beautiful voice.
Thank you. Thank you. Amateur. Okay. And
it was very nice to see you, Ilter, after many years. But we met a few years ago in Copenhagen. So thank you very much, because you gave an answer that was a big question for me: what to do with students who come back after COVID, and if they are not still recovered completely. So it was very interesting. Thank you very much.
I mean, the schedule maybe comes to ear a bit cold, you know, this level, and the step 3, step 4. But if you get used to the schedule, then it's an automatic process that you start from simple to complex, from easy to hard. So that will, for the vocal warm-ups, it works. For the before performance, it works. After performance of cooling your voice and making the massage and keeping your voice, you know, after performance morning. Hello, how are you? I mean, it's not needed for the performer. So I mean, the schedule may come to the ear a bit cold, but it works. Okay, so if there are no questions, I think there are no questions up to now.
I have a technical or organizational question.
Come on.
I think maybe some of the participants would be happy to either receive or maybe get access to the presentation, if it would be possible. I don't know if you would agree to that.
I think it's recording. It's being recorded. And after the recording and editing process, yes, it's recording. I will ask my colleague in Ankara, and I hope he will make the whole presentation to the YouTube channel or whatever you wish. Then, if you wish, you can see something, or if you have any questions, please send me your questions via email or whatever you wish.
Great, thank you. I think it will be very, very useful for us. Thank you so much.
Thank you. So, Antra, if you can close.
So it looks like we get encouraged to keep in fit, and I'm sure we will do. And we will come together and sing our songs. And so stay healthy and keep singing. And see you in next EVTA events. And my biggest thank you to you, Ilter, for your generosity to share your knowledge.
My pleasure, it's my honor. Okay, thank you very much. Thank you.
Thank you.
Thank you very much.
Thank you.
Bye-bye.
Thanks.
Thank you.
Thank you.
Thank you.